Today I can report 19 new community cases, all in the Auckland region. Of today's cases, only one is yet to be linked to another case. Also, of yesterday's cases, again, only one case remains unlinked at this point, and investigations are ongoing. And over the past 14 days, there are 9 cases whose links are yet to be established. Our progress continues. Many of our clusters are now considered to be contained. That is, any new cases are among known contacts who are already isolating, or dormant. That is, they have not given rise to any new cases in the past 14 days. So there are 5 active subclusters where there have been cases emerging in unknown contacts, and our public health efforts are heavily focused on containing those subclusters. It is this work which continues to give us a level of reassurance that we are finding and reducing the spread of the Auckland outbreak. It's clearly good to see a levelling off of the case numbers today, and today's numbers are consistent with yesterday's. Delta's high infectiousness within households underpins the numbers that we are continuing to report each day. We know from the number of already notified cases that there could be an estimated additional 35 cases in coming days among household contacts. So we are expecting fluctuation in our daily numbers. There are 23 patients in hospitals today. 2 of these are recovered cases. All are in the Auckland area, with 4 patients in ICU. Last night we reported that there had been 2 further exposure events at Middlemore Hospital on Wednesday night. The second patient, who had self-discharged, is being managed by the Auckland Regional Public Health Service and has been isolating at home. Today they are being moved into a quarantine facility. Of the 34 patients who were considered contacts following the 2 exposure events, a further 6 have now been discharged. They are being followed up by public health along with the other 32 outpatients who were considered contacts. And we just want to reiterate that while there's been a number of exposure events at Middlemore Hospital, this is not unexpected, as there are subclusters in South Auckland for which Middlemore is the local hospital. In addition, Middlemore is the receiving hospital for a number of quarantine facilities in the area, and as such regularly receives COVID suspect as well as COVID positive patients from these facilities. Where patients do present from these facilities, Middlemore is able to plan for their arrival and manage their treatment accordingly. The clinical staff at Middlemore are doing an excellent job at managing this situation. It is important that people get help when they're sick and know that our hospitals are safe, and our Auckland hospitals in particular are now very well used to dealing safely with COVID-19 patients. This includes adhering to strict infection prevention and control measures, including the use of appropriate PPE. Just an update on the worker from the Naomi Managed Isolation Facility, who was mentioned yesterday. They are in a quarantine facility, and Auckland Regional Public Health are working with the MIQ to identify close or casual contacts amongst their workers, and are also investigating the source of the infection. We are still awaiting whole genome sequencing results, which will help determine whether this is a community case or a border-related case. And finally, I'd like to mention a new initiative to get more Aucklanders vaccinated, which has been launched today at Papakura Marae and is led by the Metro Auckland GPs. This initiative is specifically for GPs with Māori and Pacific patients who have yet to receive their first vaccinations. We estimate that's about 110,000 people. So this initiative means that those GPs will be calling their patients to understand what barriers stand in their way and to see how they can be supported to get vaccinated. Vaccination, coupled with appropriate public health measures, is our ticket back to the freedoms we enjoyed and reconnection with the wider world. We've made more than a great start, so let's sustain the effort.
It remains encouraging that in today's numbers we have only one unlinked case, and that person is being interviewed as we speak. And it is important for us to note that the case numbers have been relatively stable in the last couple of days, but they continue to represent expected cases or cases of either household contacts or other contacts. But we must not be complacent, and one of the things I'm urging people in Auckland this weekend to do is get tested. We saw 19,000 tests across New Zealand. That's an excellent number, and we want to keep that level of testing up over the weekend. So I do say if anyone has any symptoms, that they please do go and get tested this weekend. It will be one of the things that Cabinet will be thinking about when we're making decisions on Monday, is our confidence that we are getting the level of testing we need to understand that we continue to have this outbreak under control. And of course, take the opportunity this weekend to be vaccinated as well. There are still many places available for people to do that. And a reminder that workplaces will be required to display additional COVID-19 QR codes throughout their premises from 11:59 p.m. on Tuesday the 5th of October. The current requirements only require one QR code to be displayed at the entrance place, and this can deter people from scanning in, particularly at businesses where there is a queue to scan in at the main entranceway, and physical distancing can then become a challenge. The aim of the changes is to limit potential barriers for people recording their visit when visiting businesses and locations, and ensures people are as given many opportunities as possible to scan in, and these should be as easy and accessible as possible. Scanning is one of the best ways to speed up contact tracing and ensure it is as much of an automatic process as can be. Delta moves quickly, and therefore contact tracing needs to move even faster, and scanning remains very important to that. More information about these requirements and access QR posters can be found on the Unite Against COVID website.